The president has a low-grade fever and is fatigued. It's way too early to tell if that will continue to be the case. Our Kelly Worthman joins us live from our CBS4 Denver studio right now with more on the president's diagnosis. Kelly?
Well, Alan, we know there is concern because of the president's age, but the commander-in-chief is also at greater risk due to other factors. So joining us now is CBS4 Medical Editor Dr. Dave Hnida. Dr. Dave, thank you so much for joining us this evening. So let's get to it. Can you go ahead and explain some of those other concerns and risk factors surrounding the president's diagnosis, please?
Well, the biggest issue is age, because we know that once people hit a certain age, in this case we're talking about age 74, we know that things like hospitalization rates and death rates increase quite a bit. And then you put in there the fact that the president is a male. That is also considered to be a risk factor for complications from COVID, along with the fact that he is overweight. And by medical standards, he is technically obese. And we know that obesity is a risk factor for complications from having COVID.
So President Trump, we know, was given an experimental antibody cocktail by Regeneron, as well as zinc, vitamin D, and even melatonin. What do you know about this treatment?
It is an experimental treatment. It is something called a monoclonal antibody treatment. And really what this is it is getting antibodies, which are proteins in our immune system that wind up fighting infection. And so what researchers do is they wind up taking some antibodies from other people who have had COVID, and just a small number, and they take them to a lab setting. And in the lab, they clone these cells, these antibodies, literally artificially manufacture them. And so what you do is you start out with a very few number of cells, and then you wind up growing artificially in many ways more than hundreds and hundreds and hundreds of thousands of these cells. You then give them to people with the hope that what will happen is they will respond to this massive infusion of antibodies in order to fight the infection. The real intent of a treatment like this is really people who are older, because older people do not tend to generate a very strong immune system response. And so it's hoped that by giving them an infusion of these artificially cloned antibodies, it'll sort of jumpstart the immune system and provide them added protection and decrease their risk of complications from COVID. But we think it has to be given very early in the course of treatment.
Well, we just saw the president just a short time ago leave to Walter Reed Medical Center. He walked out on his own. Doctor appears to be fine. So what's the purpose of moving him?
Well, I think that there's a lot of testing that needs to be done. Even though he apparently was able to walk by himself to the helicopter, we do know that he is feverish, and we do know that he is coughing. We do know that he just is feeling fatigued. And so what will happen is he'll be monitored over the next several days at least to take a look at things like lung function, make sure that his oxygen requirements don't wind up increasing, that he's getting enough air to breathe. They will also do CAT scans of his lungs in order to see subtleties that maybe might not be picked up on a conventional chest x-ray. They'll monitor his heart. They'll take a look and make sure that there's no heart damage from having the virus being in his system. They'll look at his kidney function, his liver function, because as you know, COVID doesn't just affect the lungs, it affects every organ system of the body. They're going to be keeping a close eye and doing a lot of testing on things.
Yeah, certainly a lot more information left to come. Dr. Dave Hnida, we appreciate your insight as always. And of course, we will continue to follow the very latest developments very closely. For now, Karen, we'll send it back to you.
All right, Kelly, thank you. Dr. Dave, thank you.